Welcome to the spoken tutorial on poor weight gain due to improper breastfeeding. In this tutorial, we will learn about the breastfeeding related reasons why a baby does not get enough breast milk. Recommended solutions for those reasons. Poor weight gain in babies from birth to 6 months of age has one main cause. It is that the baby does not get enough breast milk. There are many reasons why a baby may not get enough breast milk. They are divided into 4 categories. The first category is breastfeeding factors. The second category is the mother's psychological factors. The third category is the mother's physical condition. The fourth category is the baby's physical condition. In this tutorial, we will discuss some of the breastfeeding factors. The other 3 categories are explained in another tutorial. Delayed start of breastfeeding is the first breastfeeding factor. It should start within an hour of birth. Doing so will help the baby to learn deep attachment to the breast. Pregnant women must be trained in breastfeeding skills in their last trimester. Skin-to-skin contact after birth is essential to start breastfeeding. It is explained in other tutorials in the same series. The second breastfeeding factor is poor positioning of the baby. Mother should not bend the baby's neck forward. This happens when the baby's nose is positioned above the nipple. Nostrils of the baby's nose should always be in line with the nipple. As adults, we extend our neck by tilting our heads backwards to drink water. Similarly, the baby's neck must be extended to drink milk. Mother can pull the baby more towards the other breast to extend its neck. Mother should not turn the baby's neck sideways. This will make it difficult for the baby to swallow milk. Baby's chest and tummy should be lightly pressed into the mother's chest. Baby should be facing the breast and not the mother's face while feeding. In this picture, the baby's face is positioned correctly in the cross-cradle hold. Baby's upper lip is at the 9 o'clock position on the right breast. Baby's lower lip is at the 3 o'clock position. Baby's legs should be tucked well under the mother's arm. Otherwise, the baby will slip down, causing nipple feeding. Baby's hip can be seated in the fold of the mother's elbow. This will prevent the baby from slipping down. The third breastfeeding factor is poor attachment of the baby to the breast. Mother must wait for at least 2 to 3 minutes till the baby opens its mouth widely. It should be open between 120 and 160 degrees wide. Only then should the mother put her breast in the baby's mouth. Baby's lips and chin should never be far from the areola. Baby's mouth should be deeply pressed into the mother's breast. Otherwise, dimples will appear in the baby's cheeks when it sucks milk. Dimples in the cheeks also appear when there is nipple latching. Another cause of dimples is when more of the upper areola is in the baby's mouth. Mother's fingers compressing the breast should be parallel to the baby's lips. This will ensure that a big part of lower areola goes into the baby's mouth. If the baby sucks only the nipple, it will never get enough milk. Deep attachment to the breast is very important. It is important to check if the baby's attachment to the breast is deep. To do so, the mother can press the breast near the baby's lower lip. The entire lower part of the areola must be in the baby's mouth while feeding. Baby's upper lip should be just above the mother's nipple. Baby's lower lip should be at the border of the areola. If the areola is small, baby's lower lip should be on the breast. This will help the baby get enough milk. Deep attachment to the breast is explained in another tutorial. The fourth breastfeeding factor is the mother not feeding hind milk to the baby. Baby must be fed the thick hind milk that comes after feeding the foremilk. It is rich in good fats that are essential for the baby's brain and growth. Not giving hind milk will result in poor weight gain. Mother can check whether the baby has been fed hind milk. To do so, she can express her milk by hand. If thin milk comes out, then the baby has not got hind milk yet. The mother should continue to feed from the same breast. Also, she may see a good flow of thick milk when she expresses milk. This is another sign to continue feeding from the same breast. The fifth breastfeeding factor is feeding at fixed times. Breastfeeding cannot be scheduled like adult meals. The baby must be fed according to its early hunger cues. Early hunger cues are sucking fingers, turning its head from side to side, etc. The mother must recognize these cues and feed the baby immediately. She should not wait till the baby starts crying, as crying is a late hunger cue. The sixth breastfeeding factor is not feeding enough times. The baby must be breastfed at least 10 to 12 times in 24 hours. The maximum frequency depends on the baby's hunger cues. Sometimes the baby may want to have milk several times in 1 hour. The baby must be fed as many times as it wants. The seventh breastfeeding factor is not feeding at night. Prolactin levels in a lactating mother are higher at night. Prolactin is a hormone that helps in the production of breast milk. Not feeding at night will reduce breast milk supply. So, babies must be breastfed at least 3 to 4 times during the night. Sometimes the baby doesn't wake up for more than 3 hours at night. The mother must wake the baby up for breastfeeding. She can do this by tickling the baby's feet or the baby's back. She can also wake the baby up by making it sit. The eighth breastfeeding factor is the short duration of breastfeeding. The baby must be fed as long as it wants to feed. Mother should not take the baby off the breast if the baby is feeding. Only when the baby shows signs of fullness, the mother should stop feeding. Fullness signs are closing its mouth, turning its head away from the breast, etc. The ninth breastfeeding factor is the baby falling asleep while feeding. In the first few weeks of breastfeeding, the baby may sleep off while feeding. This leads to inadequate milk intake. As mentioned earlier, the mother should immediately wake the baby up. She must keep waking the baby up and feeding until the baby refuses to feed. The 10th breastfeeding factor is not offering both breasts to the baby. Some mothers feed the baby from one breast and never offer the other breast. Mother must offer the other breast to the baby after one breast is emptied. The baby will decide whether it wants to feed on the other breast. The 11th breastfeeding factor is using feeding bottles, nipple shields, etc. This doesn't let the baby naturally attach deeply to the mother's breast. To avoid them, the mother must be taught the correct breastfeeding technique. The last breastfeeding factor is giving other food or fluids to the baby. Baby must be exclusively breastfed for the first 6 months of life. Other fluids or food are not as safe and nutritious as breast milk. They may cause infections. They will also fill the baby's tummy. Therefore, the baby will not feel hungry to have mother's milk. This brings us to the end of this tutorial. Thank you for joining.